Hi, I'm John Bennick, a physician assistant at Mercy Hospital. Here at Mercy, we take patient safety very seriously. Of course, our healthcare team is responsible for keeping our patients safe, but we also believe that patient safety is the responsibility of every staff member in the hospital. In this video, we'll show you how you can be a part of one of our most important patient safety programs, preventing patient falls. A fall is defined as any unplanned descent to the floor, with or without injury. The overall risk of a patient falling while hospitalized is relatively small, from 2 to 3%. But when patients do fall, injuries often occur. Injuries can range from very minor to very serious. In the very worst cases, a fall can even result in a patient's death. We at Mercy know we cannot prevent every fall, but by working together, we can reduce the risk of falls and we can reduce injuries that can occur from falls. Mercy has a very active falls prevention program to reduce the risk of patient harm resulting from a fall. All inpatients at Mercy are assessed for the risk of falling, both at the time of admission and throughout their stay. Patients who are at the greatest risk of falling are older patients, patients who are on medications that may make them drowsy or dizzy, patients who are confused or have dementia, patients who have just had surgery. If a patient is assessed as a high fall risk, we activate our Falling Star program. Anytime you see one of the following symbols, you'll know the patient is at risk for falling. A red falling star on the door frame of the patient's room. A red dot next to the patient's name on the unit's whiteboard. A red blanket at the foot of the patient's bed. A patient wearing red slippers. Or a patient wearing a red bracelet. At Mercy, we also use several alarm systems to alert staff to patients at risk for falling. The bed alarm is located on the side of the patient's bed and is tied into the call bell system. Healthcare providers are responsible for setting the bed alarm. It is activated when a high fall risk patient tries to get out of bed without assistance. You'll see a red flashing light outside the room and hear a fast alarm. TABS monitors are small alarms that attach to the patient by a magnetic pull and a Velcro belt. When the patient tries to get out of a chair without assistance, the alarm goes off. The bathroom alarm is located in the patient's bathroom and is also tied into the call bell system. It looks like this. When the patient pulls the cord, it makes this sound, so the staff knows that the patient needs assistance. These fall alert tools are only as good as we are in monitoring our patients. Our patients depend on every member of the care team, no matter what department you work in, to take an active role in fall prevention. How you can help prevent patient falls. Keep the patient's room free of clutter to reduce the chance of a patient tripping and falling. Make sure to reset the bed alarm if you take the patient out of bed for any reason. Get help from nursing staff if you need help resetting the alarm. If you go into a patient's room for any reason, please make sure everything the patient needs is within reach. This includes the call bell, the bedside table, the telephone and remote control, the bedside tray, and the tissues and water pitcher. Also, the bedside commode and urinal should be within reach. Keep an eye on patients in the Falling Star program. Take action if you see a patient doing something that puts them at risk for a fall, such as getting out of bed without help, trying to stand without help, walking in the room or hallways unattended, reaching for something in an unsafe way. Take action. Please go into the room and talk to the patient. Remember to use standard precautions for infection control based on hospital policy.
Please stay right there. We'll get someone to help you.
You may want to stand in front of them to prevent them from getting out of bed. Call the nurse by pushing the green Staff Assist button, then stay with the patient until help arrives.
Yes, can I help?
If you hear an alarm and see the red light flashing, please look into the room as you pass by. Check to see if you can prevent a patient from falling. If you need help immediately, speak up.
I need help in 310.
Call out for help. Remember, we can all help prevent patient falls and injuries. Thank you for doing your part to keep our patients safe.